Outbreaks of vector-borne diseases like Zika, dengue, and chikungunya can contribute to significant disease burden and financial loss. Through funding from the European Union, CARFA has been working to prevent such outbreaks in our member states. Let's take a visit to St. Vincent and the Grenadines to meet their vector control officers and hear about some of their challenges.
Basically, I work with the lab section of the Integrated Vector Control Unit. I'm responsible for dealing with larval analysis. So whenever people go and they do house inspections, they bring in samples. These larval samples I look at, I analyze, and I would look at them and see exactly whether it's Aedes or Culex or Anopheles, which are the three main mosquito types we look at in St. Vincent and the Grenadines.
I've been the field assistant with the unit for about 8 months, but I've been an inspector with the unit for over 7 years now.
I am a GIS officer in the vector control unit. I basically handle all of the information that the inspectors bring in and turn it over into data that we can analyze on a map-based system.
One of the main challenges that I've faced is getting the knowledge out to persons to let them know that they are responsible for their health. The vector control unit can only do so much to protect you, but vectors and mosquitoes are a part of your environment. So that is one of the biggest challenges, empowering people to understand what best they can do to help protect themselves.
There are lots of different challenges. The labeling of the bottles is one challenge because everybody doesn't realize how important it is to make sure that you have proper labeling. The second challenge is the space. We need as much space as possible. We need more equipment for our department.
Some of the problems that we encounter is the collecting of the data, right? We're currently doing it now from a paper base over into the computer. And that is kind of a challenge where we have to transition the information over.
CARFA has conducted training in the implementation and monitoring of integrated vector management strategies to assist member states with the development of a modern, country-specific and data-driven vector control system. Let's hear how this training helped our vector control officers in St. Vincent and the Grenadines.
It benefited me greatly because education is at the nexus of anything that you're doing. Without education, you can't progress. So as much education as CARFA gives to us, we use that information and apply it in whatever we're doing, whether it's with larval analysis, whether it's looking at the way in which we do our house inspections, whether it's just collecting data and or formulating the lab.
So the training has helped us to understand how important it is for us as professional vector control workers, how we should conduct ourselves, the information that we share now, how we should fine-tune it to better suit individuals in a way that help them to better understand themselves.
It helps us to open up our eyes to a lot of things that the vector control can use and can be done to better drive vector control forward. Quite a few, in that whenever you do a particular community, a particular village, you would go back and meet our active supporters, what we call active supporters, persons who would, after you give them the information, they would implement certain things that you pointed out to them, like screening of drums, checking the water supply every 7 days. So we have our active supporters that every time we go back to that premises, that person would say to us, well, we already did that. Use of GIS, because one of the areas that CARFA has assisted us is the implementation of geographic information systems. And with geographic information systems, you now have a visual reference to data. So instead of just staring at a piece of paper with numbers, you now have reference data you could cross-reference to a map. And this has greatly improved the way in which we analyze data and the way in which we implement our intervention.
Through continued engagement and consultations, CARFA is committed to supporting St. Vincent and the Grenadines in their vector control efforts for a safer, healthier Caribbean.
Training and development go hand in hand. So each time CARFA comes here and they impart knowledge, that knowledge is applied to the way in which we do our work, and it better helps us with the development of our strategies and the implementation of whatever information is given to us.